Sanjay, we know the former vice president was brought to the hospital with chest pains. How common is that for someone with his heart history?
Well, it's certainly the first thing that you think of, no question about it, in somebody certainly of his age who's had this heart history. The first heart attack, incidentally, Anderson, when he was 37 years old, and he's had 4 heart attacks really in total. You could take a look at his sort of history of his heart, his medical problems, including the heart attacks, including quadruple bypass surgery. And then Anderson, a couple of years ago, he had a pacemaker put in. That was about 8-9 years ago. And then he actually had his heart shocked back to a normal rhythm a couple of years ago, back in 2007. So this is far and away, I'm sure, the first thing doctors are looking at, most concerned about. Certainly problems with the lungs, problems with the esophagus, those can also cause chest pain, but this is, very, very high on the list.
So if you're a doctor, you're in an emergency room, and he's brought in, someone with those conditions are brought in, what happens first?
Well, it's a very logical process. You try and figure out what's going on. In medicine, you want to rule out the bad things first, so to speak. So in his case, they're going to certainly be focusing in on the heart, but 2 things are probably going to be done in terms of medications being given. Because of the chest pain, they often give a medication, a nitroglycerin medication, which just opens up the blood vessels to some extent, and that allows more blood flow to the heart, and that probably would take care of some of his pain. Also aspirin, which acts as a blood thinner. If a clot, for example, is the problem, that's a medication that's given. But again, take a look at the list there, Anderson. This is pretty standard, really, for anybody, even without heart history, who has chest pain. EKG, they do a cardiac enzyme test, which actually can tell if someone's had a heart attack. Muscle starts to break down, and those enzymes can be measured in the blood, and they can know within a short period of time, was this a heart attack, or was this just more what's called angina, just chest pain, not necessarily a heart attack.
What kind of treatment does he undergo, do we know, on a normal basis, or what kind of medication would somebody take who has that history?
Well, you look at all the things that cause heart disease, certainly, and medications to lower cholesterol, blood thinning medications for potential clots. He may be on blood pressure medications, although he's been taking various medications in that arena over the years. But those are sort of the standard day-to-day activities. But keep in mind, he's gotten world-class cardiac care for many, many years. I mean, this is something he's been dealing with for a long time. So, he may be getting routine tests by his doctors to sort of check up on him, to check his EKG. They probably monitor this implantable defibrillator that he had to make sure that's working okay. So I think it's pretty regular heart testing and heart medications, Anderson.